It's an doing an activity smooth, purposeful, and having some direction, timing, speed, everything is very important in doing a coordinated activity. Okay? And two important structures which are very important for coordination is cerebellum, basal ganglia. Cerebellum and basal ganglia. Okay? And if you see the coordination activity, it was categorized into two types of activity: gross motor activity, fine motor activity. What do you mean by gross motor activity? Gross means using large muscles or long muscles, large muscles. So generally walking, standing, okay, running, kneeling, crawling, you are using large muscles. So doing all kind of these things is a gross motor activity. Fine motor activity means using small muscles, just humming, small muscles, buttoning, small muscles, writing, small muscles. Okay? Now we will go for coordination exercises. Yeah. There are two types of exercises: non-equilibrium coordination exercise, equilibrium coordination exercise. Non-equilibrium means no need of balance. Exercises where you are doing in a position where you don't need balance. Okay, you understood? Now I am standing, whether I need balance or not. For me, in standing, whether I need balance or not. I need balance, I need my muscles and all to maintain balance. Now, lay down. He needs balance or not? Huh? He don't need any equilibrium, no balance, because no need of it. Now he is not using any muscle, just he is lying down, that's all. Okay? Yeah. So non-equilibrium coordination exercise, you will do it in lying or sitting with support, with fully supported. Okay? So exercises which you are doing in lying and in sitting position. And in sitting position, we will call it as non-equilibrium exercises, coordination exercises. Any exercises, if you are doing in standing, in a standing upright position, in a standing position, this we will call it as equilibrium coordination exercises. So non-equilibrium coordination exercises, you will do it in lying or in sitting with support, fully support. And equilibrium coordination exercise, you will do it in standing. Okay. Now first we will see non-equilibrium coordination exercise. I will show you how to do that. Very simple. Come and see. First one, finger to nose. Finger to nose. Very simple exercises. Finger to nose. Make sure that you have to first demonstrate the patient. Today I am going to do some coordination exercise to improve your coordination. Kindly cooperate with me. Okay. So you have to, like what for all other practicals, you want to introduce, you want to demonstrate. Okay. So now see that person is comfortable. Keep it down. Okay. So supported well. Okay. Now ask the person to look forward. Better you can be therapist on front of the patient. Ask him to look at. You have to sit on the other chair. So you have to sit in front of the patient. Okay. And first you have to demonstrate. You have to demonstrate. See, you have to keep your hand abducted. Abducted 90 degrees. Shoulder abduction 90 degrees. Look straight. Look straight onto my eyes. Okay. Then try make index finger, point index finger, and try to touch with the tip of the index finger to the tip of the nose without seeing your hand. Do it slowly with natural speed. Don't do it fast or don't do it slowly. Okay? He has to maintain this shoulder abduction and he has to do like this. He should not see this. He should strike. If you are sitting in front, ask him to look at your eyes. Ask him to look at your eyes. Look at my eyes. Now do that. This tip should touch the tip. Okay? With a natural speed. It should not be too fast or too slow. Okay? Next one is what? Finger to therapist finger. Now you are going to sit in front. Okay? You are going to ask, okay, the patient's finger. You have to stand just one arm distance. This is one arm distance. Okay? This is what? One arm distance. If you are the patient, I will take your one arm distance. Okay? So one arm distance you have to stand. Now, sure. Now you have to touch this. Now, tip. Okay, so this is therapist to same abduction, and he has to touch the tip of the therapist finger. Next, finger to finger. Now next, finger to finger, same in sitting position, same position. Okay, shoulder abduction of your both hands. Okay, shoulder abduction of your both hands, and try to touch tip of this with the tip of this. You should look forward. Touch and go back. Slowly. Slowly means natural speed. With natural speed, you have to do this. Okay? If there is any problem, they will do like this, or it will go like this. This might be the problem with coordination. If coordination problem, if you ask him to touch, he will touch like this. Okay? These are the problems. Next. Alternate nose to finger. Next one is what? Alternate nose to finger. Now, first touch here, then touch here. Okay? Understood? Nose to finger, therapist finger. Next, finger opposition. Very simple. Finger opposition. Ask him to do like this. Okay? Finger opposition. Finger opposition. Next, mass grasp. Mass grasp means taking some water bottle or taking an phone. Grasp. Mass grasp. Grasp. Holding. Mass. Next, pronation and supination. For this, keep the elbow, okay, on the thigh and ask him to do supination and pronation. Do this. Rapidly. If there is any problem, they can't do this. Coordination, they can't do this. Or they will do that. Okay? Next, tapping hand. Keep it here. Just tap the hand. Next, tap the foot. Very simple. Okay? Next. Now from here you have to go for lying. Alternate heel to knee and heel to knee, heel to toe. Now you have to ask the person position. Patient has to see this, or you can place this. Okay, make sure that patient is seeing. Okay, understood? So what is that? Alternate heel to knee or to toe. So this is the toe, this is the knee. Okay, what he has to do here is with the other leg heel, he has to touch the heel, knee and touch the toe. Touch here, knee and touch this. Toe. No, slowly.
Sure.
So, you smoke? No. For people who are having smoking, alcohol, or having some medications, and old people, they will do like that. They can't do it. They will touch somewhere here or here, like that. Okay? Do with that with that leg.
That's element.
With this heel, touch here. Knee. He is touching here, not knee. Next, toe to examiner finger. Maybe he might be aged more. Toe to examiner finger. Now this is the toe. Examiner has to stand. Okay. Now you please try to touch with your toe. This to my finger. Okay. Now, good. Good. Okay. So if there is any problem, they will try to hold like that. Okay. Next is what? Heel to shin. Heel to shin. Okay. So this is the shin. This is the shin bone. You will call it as shin bone. Now what he has to do here is smoothly he has to do bone. Try to touch it here. Slowly, smoothly. Okay? The same thing. If there is any problem, they will try to do like this. They will try to hardly do like this if there is any problem. Or they will try to do like this. They won't do smoothly. As I already told, coordinated movement is a movement which you will do it smoothly, purposeful, with some direction. Having timing, speed, everything is very important. If there is any problem in direction, timing, speed, then it's not a coordinated movement. Okay? Next, drawing a circle. Now, with the leg, ask him to draw a circle. If there is no coordination, he will go like this. He can't do a circle. Okay? Next, fixation or position holding. Fixation or position holding. Holding with closed eyes, hold. If there is any problem with coordination, it will go like that. You can't hold it for long time. Understand what I am telling? Holding or positioning. If I am positioning, if I am having coordination, I can hold like this. If there is any coordination problem, my hands will go slowly opposite. I can't hold the position or fixing the position. Okay? So that is about this. This is for checking and for giving treatment. These exercises you will do for assessment and also for treatment. Okay? Next, equilibrium coordination exercise. Equilibrium means in which position you have to do exercise? Equilibrium, standing. Okay? Non-equilibrium, you will do it in chair, sitting with support and in lying. Equilibrium coordination exercise, you will do it in standing. First one is what? Standing in normal comfortable posture. Standing in normal comfortable posture. Next, standing feet together. Standing feet together. Next, standing with one foot directly in front of the other foot. Do? Good. Next, down. Standing on one foot. Standing on one foot. Very simple exercise. Okay? Next, arm position altered in each posture. So now, arm position, derived. You know derived positions? This is what position. What standing is this? Reach standing. What is this? Yard standing. What is this? Stretch standing. So that is what? Arm position altered in each posture. Next, displace balance unexpectedly. Displace balance unexpectedly. Now he is like this. You know treadmill? treadmill, down, walking. Treadmill. You know, if you are on the button, suddenly it will move. You will hold. Otherwise, if someone he is holding. Okay, so suddenly moving, try to maintaining the balance is nothing but displace balance unexpectedly without knowing without knowledge of patient, you have to displace the balance. Okay, next, standing alternate between forward trunk flexion, return to neutral position. So standing alternate forward flexion and again returning to the stand. Next, standing with eye open and closed ability to maintain posture. So first standing with open eyes and then closed eyes. Okay. But if there is any coordination problem, there might be some small sway. Understood? Yes. That we will call it as Romberg's test. Okay, now standing with eye open and closed ability. Next, standing. This is called tandem position. One foot in front of the other foot. We will call it as tandem position. Tandem position. First with open eyes. Next with closed eyes. Good. Now can you see some shaking? Open, look forward, open, close. Can you see some shaking? Next, walking, placing the heel of one foot directly in front of the toe of opposite foot. Tandem walking, tandem walking. Tandem walking. One foot exactly in front of the other foot. Next, walking in a straight line. This is the straight line. Walking in a straight line. That's all. Simple. Okay? Next, walking sideways, walking backwards. And next one is what? Cross stepping. This is cross stepping. Cross stepping. Simple thing. This is side stepping. Side walking or side stepping. This is backward. And this is cross stepping. Cross stepping. You can ask the person to do it with open eyes. Next with closed eyes. Closed eyes. Okay, if there is any coordination problem, there will be some unsteadiness in the patient. Means they may feel some uncomfortable discomfort, or you may feel some unsteadiness, loss of balance. Okay, especially in cross. There will be some problem with closed eyes. Okay. Next, march in a place. If there is any coordination problem, they will go like this. Because there is no coordination, they may move. They can't do this, or they like that they will do. Okay? Next, step forward around the obstacle. This is called obstacle. Now going there, crossing it. If there is any paper, again crossing it. Obstacles. Keep some obstacles and cross. If there is any coordination problem, they don't know what to do, how to cross. They may feel some unsteadiness, how to do this. They may go like this. They can't cross. Okay? So problem in obstacles. Next, stair climbing. Steps. You know steps? Step.
Yes.
Step climbing with handrail and without handrail. That's all. Here is, I am asking him to do hip flexion. Hip flexion. You please see the bottle. Okay? Now keep here. One. Heel touch. Next to here. Two. Alright. Okay? Or You can give some markings. You should not spoil this. You can have one chart. Okay, prepare one chart and keep it here. Keep 1, 2, 3, or you can keep some lines. Okay, now touch 1, 2, here, line, 3, 4, 5. So this is for hip flexion. Now if I want to do for abduction, hip abduction, then I will do it here. 1, 2, 3, 4. See? 1, 2, 3, 4. Here. Okay? Do it slowly. 1, 2, 3, 4. Now once if he is having good control, then what I will do? I will ask him 1, 3, 1, 2, 4, like that randomly. Okay, first sequence, next you can go for random. But you want to have, for this problem, you want to give some markings. Whatever the movement you want to do, you need to have some markings. Okay, next, the exercise is repeated. The same exercise you have to repeat for so many times. And last one, all the exercises are very tiring at first. Say first they want to use their brain more. So it will be more tired, fatigue, tired for the patient. So give some rest periods and try to do it. So altogether how many techniques? 7 techniques down. Okay, now can you see there now? Half lying. What is the position? Half lying. This is half lying. Okay, half lying. Now give markings for hip flexion. Can you see their marking? Can you see their marking on the bed? 1.
Yes.
Okay, see markings, arrow mark. This is for hip flexion. Next, down. So you want to show me in your lab. Hey.
2.
Little up. So that is for abduction and adduction. For abduction and adduction, you can do it on the bed, or you can do the placement like this. 1, touch. Next. Next for adduction. That's all. Or you can do it on the bed markings. So this is for flexion, extension, marking, and you can give your fingers for abduction and adduction. Next, the same thing which we have done already. Shabab, can you know that? We have done now shin, patella, okay? Angle shin, patella. Next. The same thing. Sliding on the crest. Shin. Do it. Okay? Next, what is this? Yeah, come on. So now here, little up. So here hip and knee flexion and extension, both limbs, yeah, do it. Again. Okay, both limbs. Next, one leg extended, do it the same time. Now this that's all. So first one, both same flexion extension, both limbs. Next, one is going for extension, the other is going for flexion. Reciprocal. Say for the patients, this is very important. For people with coordination, they can't do this. You want to give this exercises, very important. Next is sitting. Come for sitting. Sit. Knee flexion and extension. Okay, with some progression in the markings. Next, can you sit here? Okay, here. Okay, you can give again markings. 1, 2, 3. So 1, 2, 3, 4. Then again, this is in sitting, abduction and adduction for both limbs. 1, 2, 3. You have to give markings. You have to give markings. Okay. Next, the same thing with marking. How to give marking? Can you see there? 1, 2. So you have to make it as. Can you give me pen?
Yes.
Paper? It's easy. Okay. You have to make a big chart, big one. Okay, and put, because your foot, take the foot size. Okay, first, this is for me left, this is right. Now here I will make one this thing. Okay, so here 1, this side. Okay, so 1, 1, 2, 2, 3, 3. So if I ask right side 3, I have to keep it on the 3. If I ask left side 2, left side 2, left side 2. So first what you have to do here is first go for sequence 1, 2, 3. Then you can go for right side 2, left side 1. Okay, random. Okay? Yeah, next. Sit to stand, specified count. Okay, 1, 2, 3, like that. Next. So this is very important. Okay? Yeah. This again you have to make the chart. Okay? How to do this here is left, right. Okay? So here left, right. Okay? Then right angle to here. Here what will come? Left. Then again here right. Then again here left, right. Then again here left, right. So you have to mark like this. Then left, right, marking. Then again one more marking, left, right. Then again left, right.
Alright.
Yeah, if you want to go this side also you can go. You will have left, right, left, right. Same thing. If you go this side or this side, it is the same. If you are going this side, first you will keep right, then left. That is what here. Okay. Next, what is that one in here is, you will make a right. Make it common. You will turn right, keep left. Then again turn right, keep left. Then turn right, left. Turn right, left. So right will be there only. You are going to lift the left. Otherwise, you keep the left common, turn the left, keep the right. Okay? So there is a difference between this and that. So this is side turning and that is pivot turning. This is side turning, side turning. And this is pivot turning. Pivot turning. Next, standing with some weight shifting. Weight shifting to right and left. Weight shifting. Weight shifting to right and left. Next, same, walking sideways with some count. Next, this is the base of support. No? You are going to walk on that footsteps with wide base of support. Next,
Like military training.
yeah. Next, class. So these are all the exercises you can do for Frankel's exercise. Which problem you will do this? You have any joint proprioception problem, position sensory ataxia. Okay, this was given by Frankel's. So if you in exam, if I ask you Frankel's exercise, you have to show this. Understood? Is it clear?
Very easy.
Yeah. So this is called